All right. All right, Jill. So we are here for our next video on childhood trauma. And I think probably a lot of our kids, more than we even realize, have experienced some sort of childhood trauma. It's one of those things that's sort of like a hidden problem.
I would agree. I think a lot of times we might see some big or bizarre behaviors in the classroom and we've wondered why, and maybe those instances were trauma.
Yeah. I mean, I think a lot of the behaviors that we see that we aren't sure, like where's that coming from, is probably from things that we just didn't know about already. So I know we sort of have some questions that we're answering, and the first one that we're going to answer is, what is trauma? So the American Psychological Association defines trauma as a psychologically distressing event. Now, this could be something that happens one time, or it can be an ongoing issue. When it's ongoing, we call it developmental trauma, so it causes a bigger problem. The events involve a sense of fear, helplessness, and horror. So maybe right now you're even thinking about some things that you know of that have happened in our world or to you that may have been considered childhood trauma. And it's something that happens when the things that are inside of us, our own coping skills, or things set up around us, the coping skills of others, are not adequate to help us overcome whatever this traumatic event was. And it stimulates what we call the fight, flight, or freeze response, which is a great way to see what that means is the video that we've also included called, we call it Flip Your Lid for Kids. So it's a great video for you to take a look at that explains what that means.
I want to kind of bounce off what Kelly was describing to discuss how trauma can come in many different forms and intensities. It's really about how your student or the kids in your class perceive an incident. So trauma could be anything from a car accident or getting lost at an amusement park. It all depends on how that child experienced that event, the fear, the fight or flight or freeze response that was activated. Trauma can occur once, or it can be a repeated event, such as in the form of neglect or sexual or physical abuse. Some traumas that are going to be more commonly seen in our school environment as far as what our kids are facing at home might be from divorce, separation, grief, neglect, physical and sexual abuse, as I said before, witnessing domestic violence, racism, and also bullying. There are quite a few different symptoms, as we were talking about, those big behaviors and strange behaviors that you might see in the classroom. So some of the symptoms of trauma can be poor social skills, poor hygiene, just that lack of care that our kids might be missing at home. You might see an increase in bathroom accidents, fear of just common tasks or activities such as transitions, loud noises, that cafeteria environment, and even a fear of going to certain places. Specifically, it can commonly be like the bathroom. You might see a student who has trauma in their past who is more aggressive than your other students. This person could be withdrawing or isolating. They might not have motivation, so that's definitely going to make a huge impact on their academics. Difficulty concentrating, and a lot of negative attention-seeking behaviors. And as Kelly so elegantly puts it, these kids that are dealing with big events in their lives, sometimes the ones that need the most love may act in the most unlovable ways.
Absolutely. Another thing that I like to say too that I teach our kids is hurt people hurt people. And so that's, again, that child who is acting out aggressively towards other children is possibly a child who has maybe witnessed domestic violence or is being bullied themselves in another location, whether it's home or maybe on sports team or something like